What do liver enzyme tests reveal about cholestasis? Have you ever wondered how liver enzyme tests can shed light on cholestasis? Cholestasis is a condition where bile flow is impaired, either within the liver or in the bile ducts. Liver enzyme tests are crucial for understanding this condition. They measure specific enzymes and substances in the blood that indicate liver function and potential injury. One of the key enzymes tested is alkaline phosphatase, often abbreviated as ALP. In cases of cholestasis, ALP levels tend to rise significantly, often more than 3 times the normal level. This increase suggests that there is an obstruction or impairment in bile flow, making it a primary marker for cholestatic injury. Another important enzyme is gamma-glutamyl transferase, commonly known as GGT. When ALP is elevated, GGT levels usually rise as well, especially if the source of the ALP increase is the liver. Elevated GGT levels support the diagnosis of cholestasis, confirming that the issue is liver-related. Bilirubin levels are also measured during these tests. When bile accumulates in the blood, total and direct bilirubin levels can increase, leading to jaundice. If bilirubin levels rise alongside ALP and GGT, it strengthens the suspicion of cholestasis. Alanine aminotransferase and aspartate aminotransferase, often referred to as ALT and AST, are also part of liver enzyme tests. These enzymes indicate hepatocellular injury. In cholestasis, their elevations are usually mild compared to ALP. If ALT and AST levels are predominantly high, it suggests hepatocellular damage rather than cholestasis. The patterns of these liver enzyme abnormalities help categorize the type of liver injury. A cholestatic pattern shows marked elevation of ALP with elevated GGT and bilirubin, while ALT and AST levels ranges relatively lower. In contrast, a hepatocellular pattern shows predominant elevation of ALT and AST. To confirm cholestasis and identify its cause, additional tests may be performed. Serum bile acids can indicate impaired bile flow, especially in specific conditions like intrahepatic cholestasis of pregnancy. Autoantibodies, such as antimitochondrial antibodies, may be elevated in autoimmune cholestatic diseases. Imaging studies, including ultrasound and CORT scans, are often used to identify any bile duct obstructions or structural abnormalities. In some cases, a liver biopsy may be necessary to assess liver tissue directly, particularly when the diagnosis is unclear. Recognizing a cholestatic pattern through liver enzyme tests is vital for liver health. Prolonged cholestasis can lead to liver damage and increase the risk of liver cancer. Early detection through these tests allows for timely diagnosis and management, helping to prevent progression. In summary, liver enzyme tests reveal cholestasis primarily through elevated ALP and GGT levels, often accompanied by increased bilirubin. Understanding these biochemical markers is essential for monitoring liver health and assessing risks related to liver cancer. Always consult healthcare professionals for personalized medical advice and further evaluation.